Hi, my name is Dr. Sean Price, Clinical Director here at Chiro Spa in Fort Walton, and this is video number 2 in our thyroid and metabolic process series. And today I want to talk about the brain-thyroid connection. One of the things that we do that's unique in our practice is whenever we have thyroid patients that come into our office or patients who are suffering with low thyroid symptoms, we have them fill out an extensive questionnaire, we run all the lab work and so on and so forth. But we also do a complete neurological evaluation, and it's a brain-based neurological evaluation. And a lot of times people don't really understand the connection as to why we're doing that. So the way that this works is metabolism is actually the taking of food and converting that food into energy. And the thyroid controls the metabolic process along with other factors that are involved in the metabolic chain. But taking that food and converting that food into energy is the basic explanation of metabolism. So what will happen is when that food is converted into energy, the energy then goes out and the body uses that for all the different daily functions. The brain, even though it's only a small percentage of our total body weight, the brain actually uses 30% of all of the energy that our body creates. It does burn fuel to think. It does burn fuel to study. It does burn fuel to make decisions. Brain activity is very, very highly metabolic. So 30% of all the energy created is consumed by the brain. Now, if you have bad metabolism, and therefore you're taking bad food and converting that into bad fuel, then the brain's getting poor fuel. So that 30% of the fuel that it's utilizing is poor fuel. So then you'll start having neurological deficits, things like brain fog, depression, short-term memory loss, inability to find words. All kinds of these different things that a lot of low thyroid patients will suffer can be related to this bad fuel to the brain. And what's even worse is the brain, in turn, controls the metabolic process. So if you have bad fuel fueling the brain, and then you have bad brain function, and then that bad brain function is what's controlling the metabolic process, it just starts a vicious downward cycle. So we do a complete neurological evaluation with our patients when they come in for metabolic care because that brain-based aspect of treatment is critical. Hope this makes sense.